Hello everyone, this is Dr. Madhusudan Rao in the program I teach medical students. Today we are going to talk briefly on the topic blood supply of brain. Well, the knowledge about the arterial supply of the brain is important in order to make the early diagnosis of stroke syndromes and their management. Arterial supply of the brain includes anterior circulation, posterior circulation, these two joining together in the center, forming the circle of Willis. The branches or the network of the branches of these arteries supply the entire brain. Anterior circulation provides nearly 80% of the blood supply to the brain, and posterior circulation provides nearly 20% of the circulation. Likewise, 80% of the stroke syndromes affects the anterior part of the brain, and 20% of the shocks are related to the posterior circulation area. The territories supplied by these arteries, when they are injured, presents with the distinct spectrum of clinical presentation, and the clinical diagnosis of the stroke syndromes requires the adequate knowledge related to the arterial supply of the brain. Well, the anterior circulation includes internal carotid artery and its branches. Posterior circulation consists of vertebrobasilar system and its branches. These two are connected in the middle part of the brain in the interpedicular fossa, forming the circle of Willis. So let us go about these things. In this talk, we are going to talk briefly the main arteries supplying the brain and its branches, that is related to the anterior circulation and posterior circulation and the circle of Willis, and various stroke syndromes and their clinical presentation. Okay, stressing mainly on the importance of the knowledge related to the arterial supply of the brain in order to make the early diagnosis and treatment of stroke. Well, brain is supplied by the network of arteries and receives nearly 15% of the cardiac output, because oxygen supply of the brain is so important in order to provide the adequate energy, because hypoxia is going to cause severe irreversible damage to the nervous tissue. Okay, early diagnosis of the stroke and the adequate management of the vascular lesions is so important in order to avoid the morbidity and mortality. Well, as I told you, arterial supply of the brain consists of carotid system and the vertebrobasilar system. Well, two internal carotid arteries, that is one on each side, with the branches form the anterior circulation. Posterior circulation is formed by a pair of vertebral arteries which unite together to form the basilar artery and their branches. And both these systems are connected together in the middle, in the interpedicular fossa, to form the circle of Willis. Well, as I told you, brain tissue is continuous supply of the oxygen through the arterial supply. Well, vascular lesions results in the focal neurological dysfunction that is specific to the anatomical sites of lesion. That means the arteries, when they are blocked, results in the injury to the territory of the brain tissue that is supplied by this vascular system. So clinical presentation and their anatomical helps in the anatomical localization of the vascular lesion, thereby assisting the early management of stroke syndromes. Well, coming to the anterior circulation. That is, anterior circulation consists of internal carotid arteries and its branches. That is, middle cerebral artery and the anterior cerebral artery. Well, internal carotid artery is arises from the common carotid artery, enters the cranium through carotid canal. Before it enters the cerebrum, it gives away the ophthalmic artery. And its sister branch, retinal artery, supplies the eyeballs. Well, internal carotid artery connects with the posterior communicating artery, that is a branch of the posterior cerebral artery. Okay. Then branches from the posterior communicating artery, that is supply the hypothalamus. Globus pallidus, amygdala are supplied by the anterior choroidal arteries. Okay. Well, anterior cerebral artery supplies the medial surface of the brain. Okay. Then anterior cerebral arteries connect together by the anterior communicating artery. So, you see, hypothalamus is supplied by the branches of the posterior communicating artery. Okay. Which connects the posterior cerebral artery with the internal carotid artery. This posterior communicating artery is the important artery that connects the posterior circulation with the anterior circulation. Okay. Well, anterior cerebral artery is connected together by the anterior communicating artery. Okay. Well, internal carotid artery finally terminates into large middle cerebral artery and small anterior cerebral artery. This is about the internal carotid artery. Internal carotid artery is the branch of the common carotid artery, enters the cranium through the carotid canal. Before it enters the brain, it gives you a branch, that is ophthalmic artery, which supplies the retina. Then internal carotid artery is connected to the posterior communicating artery, that is the branch from the posterior cerebral artery. Okay. Posterior communicating artery connects the posterior circulation with the anterior circulation. Well, it gives away branches to supply the hypothalamus and anterior cerebral artery supplies the medial surface of the brain and also globus pallidus and the choroid plexus, that is through the anterior choroid arteries. Okay. Well, finally, the internal carotid artery terminates at the large middle cerebral artery and the small anterior cerebral artery. By and large area of the cerebrum is supplied by the anterior, internal carotid artery and its branches. The middle cerebral artery. Middle cerebral artery is the largest branch of the internal carotid artery. It enters the sylvian fissure, runs to its length, giving superficial cortical branches and deep peripheral branches to supply the most part of the anterior superior surface of the hemisphere. That is frontal lobe, parietal lobe, and the temporal lobe. Excluding the pole of the frontal lobe and the rim of the superior surface of the frontal and the parietal lobes, and the inferior part of the temporal lobe. Okay, which are supplied by the anterior cerebral artery and the posterior cerebral arteries respectively. Well, ultimately, middle cerebral artery supplies the premotor, motor, sensory areas, and the vernix area, and also primary auditory area in the temporal lobe. Coming to the anterior cerebral artery. Well, anterior cerebral artery gives away superficial and deep branches to supply the medial surface of the brain. Okay. It's the anterior striate branch supply the basal ganglia. This is the deep branch of the anterior cerebral artery supplies the basal ganglia along with the striate branches of the middle cerebral artery. Well, there is an extensive network of branches of the anterior circulation that connects with those of the posterior circulation, okay, through circular filets. Well, the wide branching network of the superficial and deep branches of the anterior circulation supplies the most of the brain except occipital lobe, inferior part of the temporal lobe, brainstem, and the cerebellum. Okay. Now, we'll show you the pictures. This picture shows the territories of the middle cerebral artery, anterior cerebral artery, and the posterior cerebral artery. So most part of the middle surface is supplied by the anterior cerebral artery. Superior lateral surface of the cerebrum is supplied by the middle cerebral artery, and occipital lobe and a rim of the inferior temporal lobe, okay, and a rim of the parietal lobe superiorly are supplied by the posterior cerebral artery. Okay, this territories of these cerebral arteries are reflected by the different colors in the picture that is displayed here. Well, this is the picture showing the anterior and the posterior circulation and their main branches arising from the carotid artery and the subclavian artery. Well, there is internal carotid artery branching into the internal and the external carotid arteries. Internal carotid is running into the cranium through the carotid canal and ultimately entering the brain substance through the anterior proliferating substance. Well, vertebral artery takes off from the subclavian artery, enters the lateral spinal canal at the sixth cervical vertebra, and runs into the cranium through the foramen magnum and joins with its counterpart to form the basilar artery at the base of the pons. Okay, and ultimately divides into two posterior cerebral arteries, okay, to supply the brain and the cerebrum. And posterior circulation and the anterior circulation are connected together to form the circle of Willis. This picture shows the representation of the circle of Willis, which is a hexagonal structure. The anterior border is formed by the anterior cerebral arteries and the anterior communicating artery. And lateral border is formed by the posterior communicating artery. Okay. And posterior border is formed by the basilar artery branching into two posterior cerebral arteries. Okay. And the branches from these arteries of the circle of Willis supply the most part of the cerebellum. Well, let us touch on the clinical significance. Well, as I told you, understanding of the artery supply to the brain helps in the early diagnosis and management of the strokes. Ischemic occlusion of the branches of the internal carotid artery results in anterior circulation stroke. An occlusion of the cortical, that is pial branches, presents with the cortical stroke syndromes, characterized by aphasia, apraxia, contralateral hemiplegia, and cortical hemisensory loss. Well, occlusion of the deep branches, that is lenticular striate arteries, results in the capsular stroke, resulting in contralateral hemiplegia. Cortical infarcts of the posterior cerebral artery presents with homonymous hemianopia, because posterior cerebral artery supplying the occipital lobe, provides blood supply to the visual centers. Thalamic infarcts in posterior cerebral artery syndromes presents with contralateral hemianesthesia. Because the sensory afferents from the posterior columns, the synapse in the thalamus before the tertiary neurons exit from the thalamus to supply the postcentral gyrus, that is area 312 in the postcentral gyrus. And involvement of the thalamus due to the lesions of the posterior cerebral artery results in hemisensory loss and the contralateral aspect of the body. Well, as I told you, 80% of the strokes are anterior circulation strokes, and 20% of those occur in the posterior circulation. Here is an error. Instead of posterior circulation, I typed it as anterior circulation. Please correct this error. Coming to the anterior cerebral artery infarctions. Anterior cerebral artery is the small branch of the internal carotid artery. Its occlusion results in the ischemic stroke, which presents as the contralateral paralysis of the leg and foot, cortical sensory loss of over the leg and foot, urinary incontinence, gait apraxia, mutism, delay and lack of spontaneity of motor acts because of the involvement of the prefrontal cortex is supplied by the anterior cerebral artery. Apraxia of the left-sided limbs with left-sided lesions and the involvement of the corpus callosum. Involvement of the corpus callosum results in a sort of aphasia that is called the cortical aphasia, that is results in the left-sided neglect syndromes. Well, this picture shows the various territories of these arteries, that is midcerebral artery, anterior cerebral artery, and posterior cerebral artery. Well, midcerebral artery lesion results in the involvement of the contralateral phase and arm weakness. You see, this represents the motor homunculus, wherein our body is represented in an inverted fashion. Areas that carries the finer movements, they are represented in the larger area in the motor cortex. Say it is the sensory area or the motor area. So likewise, lips, tongue, and the face and the hand areas, they cover the larger surface with more density of neurons represented in the motor cortex. So much is in the sensory cortex. Okay. So the red color represents the middle cerebral artery territory. Blue color represents the posterior cerebral artery territory. Okay. Yellow area is the anterior cerebral artery territory. Coming to the middle cerebral artery syndromes. 90% of the all strokes occurs because of the occlusion of the middle cerebral artery and its branches, which includes cortical branches and as well as the perforating branches and also the strial branches of the middle cerebral artery. This is the largest of the brain arteries. Okay, rather it is a continuation of the internal carotid artery. Supplies most of the outer surface of the frontal, parietal, and temporal lobes. Supplies blood to the basal ganglia. Okay, resulting in the contralateral weakness, contralateral sensory loss, homonymous hemianopia because of the involvement of the optic radiation. If it is left-sided lesion, that is, if the dominant hemisphere is affected, it results in aphasia. Right-sided lesion results in the neglect syndrome with other manifestations of involvement of the right hemisphere. Okay, like poor attention span. Okay, other features of the right hemisphere includes nominal aphasia and oculospatial disorientation, etc. And also prosopagnosis. Okay, as the ability to identify the quality of speech, whether it is emotional content or aggressive in nature, etc. This particular feature is a characteristic function of the right hemisphere. Right hemisphere is involved in the non-linguistic communications. Well, this is the picture showing the lesion involving the posterior cerebral artery. We get the cortical blindness. Cortical blindness is characterized by the loss of visual sense in the presence of pupillary reflex. Pupillary reflex is present, but patient is blind. Well, it results in the homonymous hemianopia on the contralateral side. Okay, characteristically there is thalamic pain syndrome. That is, hemi and half of the body will have the paresthesias in the form of pain syndrome. This is the characteristic feature of the posterior cerebral artery syndrome due to the involvement of the posterior communicating artery or the posterior cerebral artery itself, which supplies the branches to the thalamus. Coming to the posterior circulation, there are pair of vertebral arteries which exit from the subclavian artery, enter the lateral vertebral canal at the level of the sixth cervical vertebra, run upwards, enter the cranium through the foramen magnum. Okay, they join together at the base of the pons to form the basilar artery. Okay, in their course, they give away branches to the spinal cord in the form of the anterior and posterior spinal arteries, and also posterior and inferior cerebral artery, supplying the spinal cord and the part of the cerebellum, respectively. Then, after entering the cranium, gives away branches to the medulla, and at the base of the brain, They unite together to form the basilar artery at the lower margin of the pons. Okay. During its course, that is basilar artery, in the ventral midline of the pons gives away anterior inferior cerebellar artery, circumflex or circumferential branches to the pons, paramedian and the perforating branches supplying the pons and the cerebellum. Okay. So in Pontine syndrome, there is the infarction of the areas in the pons, okay, involving the cranial nuclei, various fibers, that is the descending motor fibers like the pyramidal fibers and other important structures which will manifest as the clinical spectrum. Okay, that will be diagnostic of Pontine syndromes, which will be discussed in the coming classes. The importance of understanding this blood supply is important to understand the clinical presentation of these lesions, thereby making the early diagnosis and effective management. Well, it's gives away the labyrinthine branches which supply the inner ear too. Then coming to the circular fillis. It is a hexagonal structure formed by the branches of the major arteries of the brain, which includes posterior cerebral artery, giving you the posterior communicating artery, which unites the posterior cerebral artery with the internal carotid artery. Anterior communicating arteries joining together the anterior cerebral arteries, forming the anterior bord of the circular fillis. Well, basilar artery dividing into the posterior cerebral arteries, form the posterior bord of the circular fillis. Well, here circular fillis importance lies that though these two circulations, posterior as well as the anterior circulations, are connected together, there is no mixing of the blood between the anterior and posterior circulation. It provides the alternative collateral circulation in the event of obstruction to the major arteries. Okay. One more important point is at the junction of the anterior communicating artery with the intercerebral artery, there will be this is the common site for the barrier aneurysms. And rupture of these aneurysms results in the massive subarachnoid hemorrhage into the interpeduncular subarachnoid fossa. Okay, this is the clinical significance of the circular fillis in brief. Well, thank you once again for patient listening. Once again, I wanted to stress the importance of the arterial supply of the brain, because basic knowledge of the arterial supply and their territories is important to understand the clinical spectrum and make the early diagnosis of the stroke syndromes and effectively manage these syndromes in order to avoid the morbidity and the mortality. Thanks once again, my dear students, for patient listening. We'll meet you again in the next class. Until that time, bye-bye.